Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub podcast, The Future of Mental Health. Hi, everybody. Welcome back to another episode of The Future of Mental Health. Today, we have another outstanding guest, Paul Gianfrido. I just hope in my lifetime, I literally could make half the impact that he has on his 40 years that he's been in this profession. If I could make half of it, I would be happy. Paul is CEO of Mental Health America, otherwise known as MHA, and is really one of the leading voices on mental health reform today. He comes from a perspective that mental health or mental illness doesn't just begin in adulthood. It usually starts somewhere in childhood, and then it unfolds over the years before someone reaches a crisis. Paul is a father of a son with schizophrenia, so everything he does, he comes from a lived experience. He talks a lot about how he lives for the day that individuals with schizophrenia could share more publicly, whether in school, whether in the workplace, about their condition and not have to fear being judged that they're a danger to themselves or someone else. Did you know that half of mental illness emerges by age 14? I didn't know that. According to a study by NIMH, we only catch 1 in every 30 children in school who need mental health support. Just think about that. We really have not done a great job as a nation addressing them at onset. We wait until it becomes a crisis, and then it unfolds into something much bigger, which is part of the reason why we have a homelessness issue. Incarceration is so high. So much of this could have been caught earlier when kids are young. Paul is going to share with us what MHA is doing from a policy standpoint and the importance of early intervention. He's blunt. He's going to share with us what he thinks are excuses that are getting in the way of eliminating the barriers on a national level. And you're going to hear a lot about just overall how we can all change some things and we can all move to a future of mental health. I can't wait for you to listen to this episode and let us know what you think.
So welcome, Paul, my good friend. You've been such a champ in this whole space for so long, worked in it in every level of advocacy, really seeing it from all perspectives, including a deeply personal one. We have a historic opportunity to kind of finally change the way we incentivize services, to break down the silos that you've been up against as an advocate for so many years. Could you kind of start to talk to us in this podcast about some of those silos between education, health and human services, housing, healthcare, and community-based services, and then maybe what we can do kind of on a federal level to incentivize states, because I know how active you were in Connecticut as both head of a human services association and as mayor of a town, seeing it all the way down to the grassroots. So I think that would be the really most enlightening thing, given all your depth of experience, for our viewers and our listeners to understand.
Well, first, Patrick, thank you. Thank you for all you've done, and just for being a friend, as well as a friend to the community. That's a pretty big question, and I could probably take, a lot longer than we have here to try to answer it. But, maybe just to kind of dive in from the beginning, the way I look at this, it's this, that, if half of mental illness is emerging by the age of 14, then we all need to recognize that these are diseases of childhood. And so we have to start trying to figure out how to integrate services that take place in our schools and educational system with services that are taking place in our health and behavioral health delivery systems. And this would be true later on for housing, for employment, for social services and supports. But it starts in my mind there. And as many times people ask me, what is it that we can do? Because you were there at the beginning of this homelessness crisis, right? 1980, post 1980, when I was in the legislature. What can we do about all of these people who, live with chronic and persistent mental health conditions, are homeless, and are in this revolving door of homelessness and incarceration and infrequent hospitalization? I always say we need to go back to the beginning and start talking about the kinds of things we could be doing, or could have been doing, and should have been doing back when their signs and symptoms of mental health conditions first started to emerge. And I think for generations, we forgot to do that. And I think that's the biggest barrier that we create. That's this barrier of siloing right from the start.
Yeah, well, as you know, the system doesn't reward a real return on investment if you just want to look at in dollars and cents, which of course is the biggest motivator in our society for policy to align. So, what would you say about these kind of new opportunities because of COVID to do things that were never imaginable about breaking down these silos between departments, because there's going to be such a need for the states to economize given the huge impact on state budgets. I mean, even if they were able to get a really rich kind of revenue share grant program post COVID to address the big deficits from having to take on COVID, frankly, it's not going to be enough to begin to really impact their state budgets in a meaningful way. So there may be a chance for the different agencies to have a more unified view of how to uh, consolidate all of their mandates to the mandate of the person and the family as a whole, as opposed to just the mandate on housing or just the mandate on education or just the mandate on human services. Do you see, just for example, in Connecticut, that being possible?
Um, I sure hope it is, because I think you've put your finger right on the most important thing, and that is building or rebuilding or building the new system of services around the needs of individuals, not the needs of existing institutions, whether they're provider institutions or governmental institutions. And the only way to do that is to, kind of work from an understanding of what people need. Now, what COVID has done, it has really, I think, brought mental health so far out into the open now, because, even up till last year, when we talk numbers, right, 1 in 5 people in any given year, going to have a diagnosable mental health condition, 1 in 2 during the course of their lifetimes. To a lot of people, that still didn't mean anything. To the 80% who weren't having the condition, didn't mean anything. But now all of a sudden this year, everybody is feeling anxiety. So many people are feeling diagnosable depression. And so it has hit everybody across all age groups, in all workplaces and in all educational facilities. So you start thinking about the fact that I think people are now trying to figure out, well, what is it that we need to do to provide supports in the workplace? What is it we need to do to provide supports in schools? I think Connecticut is positioned well because it's had a kind of a progressive attitude about some of this, and certainly the Yale Child Studies Center and some of the other Yale University programs that focus in on mental health in the workplace, the Emotional Intelligence Center that Mark Brackett runs, have already been in, the schools, and are already going into, as you know, and I know, along with our organizations, into workplaces. And so this may be a place where, it could become more progressive in this way. But, like you, I mean, I was there, during progressive times, and with a lot of progressive thinking, and the money still talks. And unless we can convince people that there's, savings on the other side of this thing that are going to be showing up in the first couple of years, it's still an uphill climb.
In Rhode Island, right across the border from you, we had all the insurers pitch into a prevention fund, and the state also pitched in to pay for things that never would otherwise be covered because they were too long term. But of course, where there's solid evidence like the nurse family partnership, first instance of schizophrenia, things that, benefit the whole system have huge value, but no one can kind of isolate that value as a specific ROI for a particular state budget or a particular insurer. So it seems to me we could get consensus from folks in an austere time where now there's a greater recognition of the need for a much better, more comprehensive public health approach to start to experiment in those ways where we have like a separate fund, if you will, secondary kind of insurance, as you will, where we could pay for those things that the ordinary insurance and the ordinary state budgets, which are year to year, don't incentivize because of the nature of the fact that no one gets credit, if you will, for the long-term investments.
Yeah, and I think sometimes for policymakers, we have to ask them, so what's it costing you this year not to do this stuff? So rather than trying to build our case as much as we have around long-term benefits and longer term returns, there are immediate short-term costs that are associated with not doing anything. How much more money are you going to have to spend on your jails and prisons this year? How much more money are you spending on providing services for people who are homeless? My son, they've had to house him in San Francisco for months now. He's doing great because they've had to house him and take him off the streets. But how much is that costing them? And so asking people, workplaces, how much is it costing you not to provide emotional support for your employees today, right now? I think that's what I think the pandemic has been able to help us turn the framing on its head a bit for policymakers and make them more willing to look at, the billions, literally tens of billions, hundreds of billions that are flying out the door because we didn't have a handle on the mental health side. That's what as you focus mostly on the mental health side of the pandemic.
Well, you hit a terrific point. But as you know, we're advocates. We get dismissed right out of hand when we say that. They said they don't know what they're talking about. They don't know about economics. But, as you know, they're great. McKinsey and Millman, they're all doing these great reports on the parity side. Millman did a scathing report on medical management practices of all insurers, essentially, broke it out by state after having analyzed 46 million payer claims data. But when you get it from a Millman, it seems like for policymakers, it probably has greater salience than if you get it from Paul and Patrick. But I definitely think that identifying the cost of the current system and saying that it's not a matter of us basically spending new money, although I'm in favor of us spending more because I think the return is so great. But let's just spend the dollars we already have appropriated through all of these different systems and align those dollars in a much more effective way. That would just do so much good for the country. But we need to have those validators, from the economic side. And as you said, that we're getting more powerful allies in terms of the chambers of commerce and others that are now really stepping up here. Talk a little bit about what you've seen in the last year, as you said, with this narrative standing on its head, where all these new players are starting to look at this as a significant area of public policy.
Yeah, well, I think that it starts with the business community in particular. I just think so many people have reached out. Mental Health America, we're doing the Bell Seal program, both to recognize employers who are doing good things, and along with a whole bunch of partners to assist those who want to do better things in the area of mental health. The fact that so many are just approaching us to both want to be recognized, but also to just find out, well, what is it that I can do for, my new hybrid workforce, or what is it that I can do for my frontline workers who can't work remotely? And then what is it I can do for all the people who are out there working remotely, who are really never going to return to the office? Suddenly, everything changed for everybody. And it's been such a disruptive experience that the disruption itself has caused people to think differently and in new ways about things like just how do I support the emotional health and well-being of my workforce. And on the school side, that certainly carries over into the teachers and the staff. How do I support them? And to, I think right now, still to a lesser extent, but to a real extent, to the students. I mean, I know I've been fairly critical, as a former policymaker, that anybody went back to school under any circumstances without providing additional emotional supports for the kids. And whether they're going to be, learning remotely, whether they were going to be learning in hybrid situations, whether they were coming back, to ignore how deeply the mental health toll of the pandemic was as we began to talk about returning kids to school and reopening the schools, I think was a huge missed policy opportunity for people. So on the one hand, I see the policy, the opportunities that we found in workplace in general. But on the other hand, I think that we've really failed to come to terms with the opportunity that we've had with our kids to recognize the stress they've been under and to figure out how to provide the emotional supports they need. And I don't want to let one thing that you mentioned pass, and that is that the Pauls and the Patricks, may not be the Mailmans and the McKinseys, the Millimans and the McKinseys, but we were there, and we know that you can effectuate change at state legislatures. I know that you can effectuate change at the local level. And often all you need is a good narrative, and we don't want to lose the power of the narratives that you're also bringing forward in this series in terms of influencing and changing the way public officials see things. One good story, one good narrative is sometimes worth 1,000 data points.
Well, I appreciate your saying that. And I think that in terms of the kids, which I can constantly hear you come back to, thank you so much for that. I just saw the Social Dilemma um, documentary the other day, and it's frightening to me that our kids are already uh, ill equipped, if you will, with the resilience that comes from human relationships because so many of them have been isolated, especially Generation Z, from that kind of constant kind of human interaction that is so essential to the growth of a human being because of the preoccupation with a phone and an iPad and the like computer that is now kind of gamified to get you addicted really to technology and you distracted from the kinds of things in terms of interpersonal skills that are so essential for those of us who fortunately made it through that without having technology being so ubiquitous, and therefore I think have a head start really in dealing with life because we've can we have experience and it's and we're connected much more so I think than these kids are able to connect because so many, even if they were able to be more independent of technology, so many of their friends are so hooked on this. Can you talk a little bit about how that's kind of gasoline on the fire of COVID, which of course, as we know, is further isolated kids and almost put them even further over the edge of technology and just communicating through these inanimate objects called iPhones.
Yeah, I mean, and again, I'll start through the lens of policy, if that's okay, because I always start through that lens. And a lot of people have asked me over the decades, what is it that makes for, good policy, and how do you get stuff through, and I say, well, it's really all about relationships, right? And that's what, people first asked me when I went into the state legislature, what's it like, working with all of these, politicians? And I said, actually, I have the good fortune of working with 150 or so of the friendliest people in the state of Connecticut,
Right.
because that's who we elect. It's based on relationships. And if you start from that premise that so much is based on our interpersonal relationships, then you see the
Correct.
problems that we have with social media that isolates children, and games that isolate children. They're not, as you've pointed out, they're not developing the relationships and having the opportunities to develop the relationships they need to. So I kind of go both ways on this. On the one hand, balance is really important. Work-life balance is important for people like us. For kids, balance is important too in terms of being able to have interaction with peers that is genuine. And hopefully we're going to get to places where that interaction will be able to be more natural in a few months again. And this will just be a bit of an aberration. But at the same time, we do need to lean into the social media and try to better humanize them. And I think that's a challenge that enough people aren't really talking about as much as they could be, because it's not, either or. It's we're going to have social media. Our kids are going to grow up. Our grandkids are going to grow up interacting this way. And so we've got to make the experience as humanized as we possibly can in productive ways. And I truly believe that. So, I'm kind of a both and person on this one, but I think this is essential that we understand that something is different here than in any other previous generation, and recognize the potential harm, but also how to realize some potential benefits from that.
Well, I love that idea of human relationships and community. It's connectedness that gives people who both have mental illness, but then are maybe other people that are just have mental health challenges. In both cases, lack of connection kind of exacerbate both situations, pushing people who are otherwise healthy into dysfunctional situations, and then pushing people who already have a predisposition to a mental illness or suffering from a mental illness or addiction over into a much more severe kind of suffering from that illness.
Yeah,
So,
people who are feeling lonely and isolated, pushing them further down a pathway to loneliness and isolation is not a ticket to recovery.
well, I think one of the things that President-elect Biden has talked about is this kind of care core, this community core of, kind of like off the AmeriCorps and President Kennedy's Peace Corps. It was about feeling a part of, it was about being part of, and helping our fellow citizens who are in need of connectedness. And when I was in politics, like you do the kind of Meals on Wheels programs, and like you said, you'd be out there in the community, and you'd see what a difference just that political connection had when you go to our senior high rises, and so much of this is about the joy that comes from people connecting with one another. And I always saw that as a politician, seniors isolating because they don't have their grandkids there, their kids aren't visiting, they're feeling ostracized in their uh, high rise, they don't have much in the way of resources. I mean, it is really disheartening just as an outsider coming in. And now you see COVID come in and further terrify seniors, and then you see society kind of almost devaluing them by writing them off. And almost we've gotten national leadership that basically said, oh, they're going to die anyway, what's the big deal? I mean, it's just heartless. And I kind of feel what our country really needs in order to get a grip on our mental health is a feeling of compassion and a feeling of the other and what they're going through. Can you talk a little bit about, in your own family situation, what difference it meant to connect with other families who had experience with a child who was going through a system that was so fragmented, and maybe what kind of consolation you got from your fellows?
Yeah, and again, I'll start from a time but before that, because the parts of my professional experience that don't end up on the resume anymore because they were so long ago and so far away, were the time that I spent in Vista, the domestic version of the Peace Corps,
Yes.
because that was the values that we had coming out of the 60s and into the early part of the 70s. And when you talk, seniors and the political work that we did, I often tell people, the reason I got a lot of votes from people, over the age of 65 back when I was 25, didn't have so much to do with my great, policy advocacy work that I was doing. It was based on the fact that I'd been playing my accordion for years, and in the nursing homes. And, when it came time to cast a vote, they wanted to cast a vote for somebody who connected with them,
Right.
because I knew all the gay 90s waltzes, and that's what they wanted to hear, because those were the songs, the World War I songs were those, shows you how old I am. The World War I songs were the songs of their youth. And so learning early on about the importance of the emotional connection and how that brought people who I didn't even know, out of shells and out of depression. The rec directors would, tell me this, how important it was that I would do this, really came back on a very personal level for me, because, my son, Tim, developed schizophrenia when he was 5 years old. And, he wasn't diagnosed like a lot of kids for another 10 years, and he's lived his whole adult life with it. He's in his mid 30s right now. But it is so isolating to have that in yourself, to be constantly, questioning, your parenting skills, be constantly questioning, what it is that I've done wrong, and how is it that I'm not able to reach this. And when I wrote my book and began to tell, my story more and more about this, I was just floored by the number of people who came up to me and told me similar stories and how important it was to be able to get the support, family to family, for this stuff. I mean, I used to say, people say, well, look at that. You were in politics. You were mayor of your hometown. You knew everybody there was to know in the state of Connecticut. And look what happened to you. If that could happen to you, imagine what somebody that didn't have your connections would happen to them. And I would say, well, the good news is it wouldn't be any worse, because it couldn't have been worse what happened to me. Then I would tell this story, and I have teachers come up to me and say, never understood until I was on the other side of that parent and planning PPT, we would call them, developing the adult education programs. So I was on the other side of it, what it felt like to be on the other side. Lawyers who would come up to me and say, it was one thing I'd be advocating, I'm great advocate for other people, but it was me, and I'm now the client. And doctors, psychiatrists came up to me one time and said, I had no idea, but I don't know what to do, for my own son who's in his 20s. It's so important that we're back to connections, we're back to relationships. It's so important that we use these connections and relationships to understand that we're all in this together, and there are a lot of common experiences, and then our expertise can be brought to bear together to make a difference here. But honestly, if I hadn't heard from and talked to so many other people who are literally in the same boat that I've been in, I don't know how I would have gotten this far. I don't know how I would have ever been able to deal with, what it is that Tim has experienced. And why that's so important is because, what I've experienced is 10% of what my son has experienced. And we love each other to death at this point. Love talking to him, love interacting with him. He can't wait till the next time I can come out to visit him. And I'm so looking forward to that. And it's just like, we wouldn't have been able to have that, had we not had some context and perspective on, and me personally, having a lot of perspective on what he, having the lived experience, is going through. Sorry for the long answer.
No, I just want to say for all of our listeners that, Paul, you have helped build and grow Mental Health America so substantially at a time that's so critical to our nation, to have that as a meaningful resource for those that are just getting in the advocacy world. And it's really been in large measure to your personal experience, the suffering that you went through as a father, the narrative, like you said, that you've gone through, and how much that has been so compelling to bringing people to your side, because there's so many others, and you've just had a certain way, because of your political background, of translating that into an advocacy role. So it kind of takes people outside of feeling so burdened by their own experience. They now can have an outlet to do something. That's the great thing that people in politics, if they're effective, can be able to do. Maybe could you talk a little bit about the expansion of Mental Health America as the executive director that you've helped kind of facilitate, and where you think that's going in terms of the expansion of activities within the states as well? I know you mentioned the Bell program, which is significant in building out advocacy within the employer community. But talk a little bit about the other things that Mental Health America is doing to bring these folks who want to be part of the solution into the fold.
Yeah, I think that, and again, I thank you for the, the very kind words about my role in this. But MHA has gone through some extraordinary changes and made some extraordinary strides in the last few years, and I'm very proud of everybody who's been a part of it. We were formed by Clifford Beers, a man with lived experience more than 110 years ago. And I think that some of the work that we've been doing to advance the certified peer specialist as a critical and essential professional on professional care teams, both clinical and non-clinical, for people with serious mental health conditions will bear fruit and be really important in the next decade. I think what we've been able to do with our online screening program, which we started in 2014, and where people can go and take a free anonymous mental health screen. Last month we had 400,000 people in a single month come and take a screen. We've now had 7 million people overall take it, and the pace is more than 10,000 people a day. Sort of the recognition that we can identify mental health concerns before they become mental health crises, and that we can intervene effectively early to move people along pathways to recovery, I think is something that's going to continue to move forward. It just helps bring people out into the open and bring people's stories out to the open and help everybody understand that it would be possible, right? It would be possible to build a system around the express needs of individuals, and it would look very different, the mental health delivery system, from the system that we have today, which is focused to a great extent on deep end crisis, post-crisis interventions. So I think we're headed in that. We've been heading in that direction. I think we're headed in that direction in the future of having a more inclusive mental health for all as we move forward. And I think that as we work with employers and as we work with educators, as we work with individuals through screenings and early identification intervention, as we continue to put front and center the experiences of people who have lived with and successfully so mental health conditions, and consider to keep in front of us our eye on pathways to recovery. All of that is the direction we're headed in, and the direction I hope we're headed in. On top of all of this, too, is the end of the incarceration of all people with mental health conditions who are nonviolent, based solely on the fact they have those mental health conditions. This is the one thing that if Clifford Beers was coming back a century later looking at, I think he would have considered to be his greatest disappointment, that we haven't moved the public safety model yet, and we're still providing custodial care services for far too many people in our jails and prisons, wasting far too much money and far too many lives for no discernible reason.
It's so fascinating just sitting here listening to the two of you with such depth of experience discuss this, because we've touched on Gen Z and the attachment to technology and digital phones and everything that's not going away. We've touched on seniors and their need to be connected. Touched on families and lived experience and what it's like to have these issues firsthand. And I think just like any advocate, we hear this, the minute that you open up your story, you're a magnet to everybody else who has those stories. And, we've touched on incarceration and the broken model, and then what Patrick did in Rhode Island and what you were able to do in Connecticut, and then all the screenings and the need at MHA when you see, 7 million pieces of data of screenings. You can see the pervasiveness of mental health. Just in this short period of time of this conversation, it spans to we think about your son at age 5, it spans to everybody, doesn't matter the decade, doesn't matter where you live. It's across all everything. And the one commonality is how broken the current system is to support. And with advocacy, we're making a difference. People are coming out and they're sharing their stories, and they're recognizing that this is what life is, and that, mental health, mental wellness, mental illness, all of this spectrum is there somewhere. But going back to some of the earlier things that we talked about the ROI and how do you prove that, I think Patrick said, in Rhode Island, everybody put money together into a fund. How do we move that? How do we tell the story so that there is an investment and people are able to see that, just to your point, that the billions of dollars could be saved on? And I think the interest is there, but how has there been a time where we have a good example where it's been done, it's been proven, and out of it something positive has come in as far as change?
Well, I think there are some examples, and I think they've been with us for at least a generation right now. This year we've been celebrating the 30th anniversary of the passage of the Americans with Disabilities Act. And outside of the behavioral health community, there have been so many successes and so many changes that have occurred. So if you look at the other two biggest populations, you could say, that have been affected by this, you'll have, the elderly population, which has to a very great extent been deinstitutionalized over the course of the last generation, where so many services are provided through home and community-based waivers now. And similarly, if you look to the a constituency with which, again, I spent a lot of time in the state legislature, and Patrick's father spent a lot of time in the U.S. Senate at the same time. People with intellectual and developmental disabilities, we move people from institution-based services through group homes to supervised apartments to pretty much full community living within the span of about a generation. It took some time and multiple steps to get there, but we got there. And we did that. We made those investments at a time when we had largely institution-based systems, which were sucking up just billions and billions of dollars, the nursing homes and the large custodial care facilities. So we have two examples where this has been done and been done over the course of the last generation. The thing is, we're just behind them on that. I like the idea of amassing funds. I also like the idea of a broader use of home and community-based waivers. Patrick appreciates big numbers like I appreciate big numbers. Most of the advocates are like, you start talking billions here, but they're like, wait a minute, stop, they're never going to give us billions. The home and community-based waiver program, is upwards of $100 billion program right now. We could be added onto that in further ways, and states have endorsed and embraced home and community-based waivers as opportunities for service delivery. So I do think those are big examples, mega examples that we can point to where systems change occurred pretty much in the last 30 years. It's very different from when I entered my state legislature in 1979. And we could do that here too. And it would have the same beneficial impact on the system of making certain that the investments became much greater in individuals, but that the systems that were benefiting from the segregation of services would not benefit quite so much.
So that the system isn't like we've seen it to be a kind of fee-for-service transactional process, but rather an outcomes-based process where the value is in whether you've done a better job at helping to stabilize people, address their total needs, because it's the only way of addressing their medical needs per se. And of course, our system's set up around medical reimbursement. But frankly, and we know this, if you address some of their non-medical needs, it actually drives down their medical costs, all of which can't be captured in the current fee-for-service kind of system. So I love your talk about waivers, because I really do agree. I think there's some huge opportunities to change the paradigm on this, and to do it both for the interest of those who are needing those services and aren't getting them because of a fragmented fee-for-service system, and in the interest of the government, which is trying to economize on the resources that they have to make sure they get the biggest return, if you will, on their own investment. So these are extraordinary opportunities, and I appreciate you putting that in the context of what we've done in the past, because we have to make people understand this is possible. The vision is there. I often quote when President Kennedy signed the Community Mental Health, he didn't refer to pharma, psychiatric centers, institutional care, psychiatrists. He talked about communities because he saw it as everyone's job. And like you said, everybody's impacted one way or the other. If we look at this as everyone's issue and not some kind of segregated special issue, then the answers will become apparent. They will include, education, geriatrics, primary care, housing, criminal justice system reform, and because it really does touch on everything. And as a community, we really haven't had all of those issues enumerated by those other issues, so that those other issues understand that their agenda is really our agenda.
Yeah.
Talk a little bit about the need for us to expand our advocacy so that we're bringing in, folks that want to have, the educational unions who want to have better literacy and numeracy, but can't do it, to your point, unless they're social emotional learning. The sheriffs and the criminal justice system, who knows that they're just arresting the same people over and over again, is saps all their time and budgets, and could be better handled, like we've seen with Judge Leifman in Miami-Dade. and on and on and on. So talk a little bit about us trying to harness their support for our advocacy so we could get these changes. Because right now, as you know, in our space, we really are struggling to create enough heft to move anything forward. We need all these others to help us get to where we want to go.
Yeah, and our space is by nature isolating, and so we do a really bad job of reaching out to people, and inoffensively so sometimes.
Yes.
I know it's like I don't know a single sheriff or police chief I've ever talked to who really thinks that they want to be the first responders. And I have a nephew who's a police officer. None of them want to be the first responders to mental health crises. And so, what a natural constituency for
Yeah.
the system that we will build as a result of 988 going into implementation in a couple of years, right? Because we can have a brand new emergency response system that we can build that where the police are just the backups, like they are in the existing 911 system if you're having a heart attack or something like that. And so right there is an opportunity right in front of us over the next couple of years to engage the public safety world and community in this activity with us. Right in front of us is the opportunity to engage the educational community. They see what's happening with kids. The teachers, my son's kindergarten teacher saw what was happening with Tim. It took 3 years before we got him into special ed, but they're there every day. They're spending 6 hours with the kids every single day. And so they know, when something is different and when a need is there. So the opportunity to reverse this 20-year trend we've had, where we have been reducing the numbers of kids who are getting special ed services on the basis of their emotional needs, on the basis of that particular label that would be applied to kids with SMI. It's an opportunity to do that, but it's not that our kids have become 50% or 30% healthier, that we've gone from 500,000 a year down to just under 350,000 a year who are getting services nationwide, just 350,000 kids. Let that sink in, between the ages of 3 and 21, getting special ed services as a result of their serious mental health condition or emotional disability that they've got. About 1 in 30 of the number of kids who probably have one that's interfering with their education. So there's an opportunity, and that does engage the teachers, and we've seen it. The teacher unions, we've seen the principals, we've seen the school boards all want to work with us around these kinds of initiatives. So, we've got friends in the public safety arena, we've got friends in the educational arena, more workplaces, employers coming in, we've got friends in the business community. We always tell people, don't we? It's okay to ask for help. And then we're always afraid to ask for help ourselves. And all we need to do is ask these people for a help as advocates. I think they're ready to offer it.
It's so interesting too, because you're right. I mean, we just talked about how mental health is everywhere. So why wouldn't we bring in these other entities to join together? Because if mental health is helping with education, then all things are better in the school systems too, and in the first responder community and all of that. So what, besides not knowing how to do it or having a hard time doing, what's stopping mental health from putting a larger kind of wraparound approach to this, bringing stakeholders together and saying, this is all of our problem?
Yeah. Well, a couple things, I think. One is that hard to characterize us maybe inside this way, but we're shy. And I think one of the things is we're shy. And I think another one of the things is that we, as an advocacy community, let the ADA opportunities and the IDEA, Individuals with Disabilities Education Act, opportunities get away from us a little bit too much. And I think that the third really is, gets to the whole notion of stigma and all the associated and affiliated discrimination that comes around with that. Nobody has ever wanted to talk as openly about mental health and behavioral health as people are willing to do today. And a lot of this is driven by younger people in every generation. It's perhaps been driven more by younger people, but there was so much of this that was closet even when I was a kid. I mean, nobody talked about any of this. And so, we were just frightened, I think, by what the reaction of people would be. And I'm still looking forward to a day where somebody will be able to proudly declare in a workplace that they're living with schizophrenia as a sidebar to a job that they're doing where nobody noticed or paid any attention to the chronic condition or disability with which they were living. We're not there yet. I mean, I think in still probably the vast majority of workplaces, if we said, I've got schizophrenia, if somebody were to say, I've got schizophrenia and here I am, except in a place like, MHA and advocacy world, that'll still be a negative. And a lot of people will still immediately think, this means this person's going to be violent. This means this person's going to be dangerous to self or others. So I think the public safety narrative about these conditions also just has been too much a part of our world for more than the last century. I mean, this has been a century and a half now. So that's probably contributing to the stigma that people feel. But those would be the three things I would point to and say it's the only reasons. And it's not impossible to overcome these things. Again, these things were overcome by other constituencies in our lifetimes and in the last generation. And so, let's move forward with hope.
I'm curious, I used to run a nonprofit before Psych Hub and you're running a nonprofit, and in the nonprofit space, there's a sense of there's a lot of urgency around money, right? And so it's like my sandbox, my toys, and not wanting to kind of share that with anybody else.
Yeah.
Is money maybe potentially a fourth thing where it's possible that these different entities have their funds and there's concern opening it up because they're losing funds, or is there enough to go around if it was just proportioned differently?
Yeah, I think money's a reason, or excuse, but not a reason. I mean, my daughter was doing, disabilities advocacy work a few years ago, and she used to meet with, legislators, and she met with a state legislator, was, used the money argument and said, you all need to understand, you human services people, the pie's only so big. And, and every good cook knows you can only slice up a pie so many different ways. And she came and reported that to me. And it was a successor legislator friend of mine. And I said, well, next time he says that to you, say, well, every good cook also knows that, whenever you're baking a pie, there's always a little extra dough left over. And so just give us the leftover dough. And I think that, the dollars are out there. They're simply misspent. And like Patrick, I believe that it's hundreds of billions of dollars we need. And I'm not afraid to say that it's hundreds of billions of dollars we need. We as advocates need to say we are hundreds of billions of dollars short in areas that matter. And for people who say, well, nobody's ever going to raise their taxes to do that. Nobody's ever going to want to, bust the budget to do that. I just go back to them and say, well, then just give me the opportunity to take it from the places you're wasting it. And so if that's the way you feel, then I can point out hundreds of billions of dollars of places you're wasting it and give me a chance to talk to you that's affecting my people. And again, for me, I'm open book on this. I'm talking oftentimes jails and prisons and saying, just give me the opportunity to take those dollars then and to redirect them, because we don't need to be keeping as many jail and prison beds open as we do. We're far better than every other civilized nation and probably every other nation in the world in making jail and prison beds available to our population. How is it that we can do that, but we're not capable of investing those hundreds of billions into the lives of people who really could use the help? And so I'm just there. So I don't think, people point to money quickly, and a lot of times I have to shut people down on that one because, yeah, great. I used to do that too. we only got so much. We only got so much. No, we don't.
Well, of course, with cancer, we've just spent trillions and trillions. And I remember in Congress, no one even asked what the budget was. We just increased it, and whatever the NIH needed for the NCI, National Cancer Institute. I mean, it was just the check was written. And thank God, because I mean, everybody in my family's had cancer. I mean, I'm so grateful for that investment. But, like you said, everyone's going to be affected by mental illness in some form or another. And if we're so intent, frankly, on taking over neurodegenerative disorders, because they're going to absolutely swamp our federal budget with red ink, given the impact of Alzheimer's and other neurodegenerative disorders, it just makes sense to frame this again as when you're going in to understand the galaxy of neurons in the brain, to help us untangle what it is that were the mechanisms of action to help, eliminate memory for people. In the process of all that, you're going to learn all about how to better disentangle, the synapses that may have caused a mental illness or addiction. And we know that the brain is the brain is the brain. You cannot go in there and say, oh, we're only going to, for political reasons, just get dementia, right? Because,
Right.
my Aunt Rosemary was the impetus for my Aunt Eunice getting her brother, President Kennedy, to start the National Institute for Child and Human Development. And they started researching dementia 40 years, 50 years ago, as a result of the fact that so many people with intellectual disabilities had as one of their primary symptoms dementia. And so before it ever became known as Alzheimer's, and we studied it as Alzheimer's, and it had an urgency because it was Alzheimer's, we laid a lot of the foundation at the NIH, and it was because of our interest in helping people with intellectual disabilities. So ironically, Eunice's husband, my Uncle Sarge, died of Alzheimer's, but she was in charge unwittingly by looking after her sister Rosemary for helping to advance the research so much that Sarge's kids, her kids, 5 of my 5 Shriver cousins, who are all concerned, understandably, that they might be predisposed for Alzheimer's, now have a better shot of getting both treatments and cures earlier in their life expectancy than they would otherwise, because of their aunt with an intellectual disability 60 years ago being the impetus for an institute started in the name National Institute of Children and Human Development. Who would have imagined the Institute on Children would have helped unlock the door for research that now comes through the National Institute on Aging and neurodegenerative disorders? So it just shows that we also have to frame this in context of, if you want good diabetic care, you better make sure that their alcoholism is treated. If you want to get good oncology care, you've just been given the diagnosis of cancer, you better address anxiety and depression. And if you're not addressing that as an oncologist, you're actually, not doing your job. And making those other health specialties advocate for our agenda. So it's not as if we are looking at it in an isolated way as well. All those things, I think, as you point out, are very helpful to advancing this for the broader public.
I think that's right. And I think you've brought out a couple things there. One is, again, the power of the narrative, right? It's the story that you can tell around this about how something got created. And then secondarily, it's, in other areas, people don't ask the price tag every single step of the way. And we've let them, and in a sense, we don't even make them ask anymore. We do it to ourselves to say, well, this is going to be so much, and this is going to be, how could you possibly do this? The fact of the matter is, I don't know, for example, and the last time I knew, right, how much it cost to build a mile of highway was when I was a little kid, and my dad said to us at one point, it costs $1 million now to build a mile of highway, right? And ever since then, I went through 13 years in public office. I never knew, still don't know, what does it cost to build a mile of highway? Nobody asked that, and yet everybody's asking us all the time, and demanding that we tell them what's it going to cost, to to move people, a mile along the pathway to recovery, which may be 1,000-mile journey. And can we really afford that, And so, before we talked about, can we afford not to do it? But there's also this other part about where are our values? What is important to us? And is, a healthy life, life, liberty, pursuit of happiness are these fundamental values truly for us? And are they really important to us? Because if so, then we look at people holistically and we say, that's the purpose. That's the purpose we have formed this union. And if that's the purpose that we formed it, then yeah, it doesn't make sense to be segmenting people into, people with diabetes and people with mental illness, people with cancer, people with it doesn't make sense to be segregating people into different systems of care, services, and supports and treatment, which are fundamentally discriminatory, right? And what makes sense is to build, as you said earlier, build from people's needs, build from what it is that's going to enable everybody, to live well, to live healthy lives. And if we start from there, then maybe we ask different questions about these issues, and we ask different questions of the people who are really just adding conveniences to our life, like bigger highways, with more lanes on them. What's more important to people? 12-lane highway running up and down the state of Texas, Interstate 35, with service roads on both sides of it? Or would it be more important to the people of Texas for that to be a 10-lane highway, still with service roads on each side, but in return for which everybody got the mental health services they needed?
Paul, you are just an incredible advocate, wealth of information. I mean, you've been at this fight for so long. You have so much information and knowledge in you. And I hope that you continue using I feel like we could just talk to you all day and just go on and on, because it's like, I just want to pull everything out of your brain. But I hope that you continue to never lose your passion, to keep, fighting for this fight and bringing in common sense approaches. You just recently made a very big announcement that you will be retiring from MHA in this summer of 2021. What legacy do you want to leave behind, and what do you hope to continue to do in the future?
Well, I mentioned that accordion, right? So,
Oh, you're going to take up the accordion again.
There's one back here and there's another one over there. So my two accordions will come into retirement with me, as will some self-care, come into retirement with me. And but looking back and still to an extent looking forward, I've been proud to be able to help play the roles that I've played over the course of my entire professional life, which really has culminated in Mental Health America, in a place I never would have imagined even 10 years ago I would have ended up. Certainly when I started in the state legislature, I tell people the only reason I ended up doing health-related work in the state legislature was because I was the youngest person there and nobody else wanted to do it. So it was assigned to me. And when I told them I didn't want to do it, I was an environmental activist. I wanted to stop the use of nuclear power and move us to a solar and wind-powered future. Turned out it happened anyway without me. So I'm glad about that. But I just, I never imagined, I'd come down this path. But I'm hopeful that, I've been able to help to articulate the importance of prevention, the importance of early identification and intervention, the importance of public health, generally in our area too, something that has gotten so little attention, but has meant so much in improving the health and well-being of the entire world. And, and looking forward, I don't know that I'll ever shut up. But, and so I'm, I don't know, beyond this, I'm so, as I said, I'm so proud of Mental Health America. I'm such a believer in what it has been over the past century and the 7 years that I will have been there. And then the promise of Mental Health America moving forward and the promise of the entire advocacy community. I've made so many friends in other organizations when, that 7 years ago, none of us were talking all that much, and I think everybody has come together in ways that I'm really proud to have been a part of. And I just, and we'll just see, we'll just see, I've tried to learn, not to plan too far ahead. I think, for, somebody with, anxiety, like I've got, occasionally you can get carried away on what things may look like 10 years from now or 20 years from now. So I'm trying to stay focused on the next few months and the work at Mental Health America. And then after that, I'll kind of focus on, what comes there. One of the best things I've learned from my son, Tim, is patience, forbearance, living in the present. And so he does a great job with that. So I'm going to try to pick up some of those lessons and go from there.
Well, as we say in recovery, you're not alone. And I love fortune telling. I love thinking about what's going to happen in the future. It's no way of knowing what's going to happen in the future. I love catastrophizing, thinking everything's going to go wrong and nothing's going to work out. And again, the real challenge every day, and that's the beauty of 12-step recovery, is it's one day at a time. It's all you focus on, and then things work out the way they're going to work out for the best. If you're doing the next right thing, that's the best preparation of all. And your whole demeanor and your gifts in terms of relationships, like we talked about in this podcast, have really opened up the whole system, because you have made friends across the board. You've helped coalesce and build those coalitions, which is crucial now as we've entered in this huge public health crisis, not just of COVID, but of mental illness and addiction. So the timing of your service as head of Mental Health America, you have to feel like you were where God needed you to be, and in the fulfillment of all of your gifts, to the maximum good for both Mental Health America and for our country. And because by the time this airs, people will be kind of acknowledging your retirement. And I want to add, because it is an opportunity for me in a public way to say how wonderful you've been for this whole movement, and that your friendship has meant a lot to me, and I know will continue well on after you depart. And I just want to say I'm grateful for that, and wish you well, Paul, and thank you so much for coming on.
You've been a tremendous resource to all of us. MHA is an incredible organization, and all the different things that you're doing. And I'm just really grateful for your honesty and your humility and your voice, because it's made the difference for so many.
Well, thank you, Marjorie, and thank you, Patrick, and thank you for inviting me to spend this time with you today too. It's really been great.
What's cracking, Hope Nation? It's your friendly neighborhood Kevin Hines, and here is your Psych Hub Brain Health Tip of the week. While healthy food choices keep your body and your brain nourished, did you know that there are certain foods that can help with mental performance? Yes, increasing your intake of foods rich in carotenoids, which are loaded with antioxidants, help boost your brain health. Studies show that it helps prevent aging of your brain, keeping you tip-top in your mental health. Things like carrots, tomatoes, spinach, sweet potatoes, eggs, avocado, kale, and more. Next time you fill up your online order and head to the grocery store, ensure you're shopping on the outside aisle and choosing non-processed foods. Things that aren't in bags or boxes. You got this.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.